I've been Attorney General for about a year, and I've, during that time traveled throughout the state. And what has struck me is when I talk to chiefs or other law enforcement and ask them, what's the biggest problem? One of the biggest problems they face almost uniformly, let's say, prescription drug abuse and heroin abuse. It's right up there when I have conversations. And it doesn't matter where I go, the North Country, our cities, impacts rich and poor, young and old, as we've heard. It simply has no boundaries, that the heroin and opiate problem. And by the way, when I meet with attorneys general from around the country, you hear exactly the same thing. I'm sure your colleagues are hearing the same things in their home states. Big portions of our meetings discuss opiate and heroin abuse and what various states are experiencing and what they're trying to do about it. And to me, I think what maybe makes this cycle a little bit different, and the chief mentioned it, because people are starting often with legal prescriptions and then getting hooked, I think a different population is turning to heroin than otherwise would have happened. I mean, even on a personal level, I had minor knee surgery at the end of last year. I got a prescription for 30 tablets. I probably needed about 6 or 7. I thought to myself, if I took all 30 and I was sort of prone to addiction, would I have had a problem? So the prescribers maybe need to be thinking about what they're doing a little bit. I don't think, and the chief said it, that we can arrest or prosecute our way out of the problem. We'll be vigilant. In fact, I've asked the legislature to add another drug prosecutor to our team, and that's going to be heard this Friday. And we have additional members of our drug task force being added up in the North Country. But still, I think what we probably need more of are treatment alternatives. Although it's a controversial piece of legislation, one of the things that the state is doing with the passage of the bipartisan New Hampshire Health Protection Program, which brings the Medicaid dollars, is fortunately that brings with it a substance abuse benefit, which is a good thing. I think it'll create sort of a payment stream so that hopefully we'll have more facilities to provide treatment. There's a real shortage in New Hampshire. If you talk to folks, maybe we'll hear about that a little bit later. And hopefully that will add things. And the senator mentioned her support for mental health legislation federally. The state settled a mental health lawsuit, and there's also co-occurring problems between abuse and mental health. So we'll get more mental health treatment. So those are two good things that happen. And the other thing at the state level is there's the Department of Safety and the governor have been working to put Narcan into more people's hands, and at least at the EMT1 level, that's going to be done. And I know that at the law enforcement level, there's discussions and perhaps a study to look to see whether police departments will get it. To me, the other thing we need, and it was mentioned, we need just more public awareness, more education. At least until the death of Seymour Hoffman is very sad, obviously, but I think it did bring it to the front pages of the newspaper, oddly. I mean, when I was talking to all of you, if I would go home and talk to my friends who are not in law enforcement, they didn't really see it as a problem, I don't think. I mean, Manchester and Nashua had an increase in robberies and burglaries this summer. One of our local grocery stores, I'm sure the senator knows well, in the North End, had to close up early. It had always been open late, so it was affecting people's lives, but it didn't bubble up the same kind of way. So I'd like to see us find a way to have more awareness, find out how to get to young people and educate them. How else can maybe the federal government help? I'm sure the senator's familiar with this hydro issue and FDA.
Yes.
That's a problem. Attorneys General working on that. I know there's a number of people at the federal level who are looking to maybe have the FDA change its approval of that. It's terrible.
Right, a category of
Makes
that.
no sense
No,
at
it
all,
doesn't.
what they did. And the Senate, more federal funding hopefully for drug courts and other things would be very helpful.
Great. So thank you very much, Attorney General. Appreciate it. What I thought we would do is open it up for an open discussion of what you're seeing, what's on your mind. And since we've heard the law enforcement perspective, so I'll pick on and then open this discussion. We're picking up with pick on Dr. Wilkie over there on the treatment side, and then why don't we just open it up for a full discussion? I just want to hear what you think, what you're seeing. How do you think we can get at this problem and work together?
Thank you, Senator. Thank you all for having me here today. We've gone all over the country to find out what we're going to do for treatment. And what we're doing is we're bringing the money back to the state. So now the people that were leaving the state are checking into our facility, and we're billing insurance companies, which is where we need to get the payer mix, because everybody was living on a shoestring budget from the federal money that would come through the block grant to the state, then to us providers, and we weren't even able to pay for the food or the milk, and so really, the people that were working in the facilities couldn't feed their families. So I think we're heading in the right direction, and all the money that we get always for the drug courts and the burn grant, second chance, and it always, every dime helps us. But when we talk about the $30,000 a year that we're using, I think that we could, you know, use our jails and our prisons to do some treatment. We've done it in the past. They're a captive audience. We're already paying $30,000 for them to be there. You know, and if we can figure out a way to make a tier or two a pod substance abuse, I think we get a little bit more for our money. That's just my thought about all those people sitting there doing kind of nothing, waiting to do their time, and yet we could do a lot more with them. But, you know, I'm really glad that it is, I've been to more funerals in the past 5 years than I have in the past 27 of doing this. That's how long I've been doing this. So I'm really glad that it's finally been brought to the attention of everybody, and that we're all having to look at it. It's affecting all of our neighbors, our friends, parents are coming to us distraught, they don't know what to do.
Thanks. I got a letter the other day from a family that, the son had basically overdosed on heroin, and that's what the family was writing me about, just, we didn't know where to turn. We didn't know where to go, and I think that's to the point of the Attorney General and yourself, Doctor, is just the awareness in the community of what is there is important as well as we build the capacity, because, you know, this affects every socioeconomic group. As I'm hearing the impacts of this can happen to anyone, and people don't know often where to turn to if they have a family member that they want to help and get out of this cycle.